In the Philippines, tuberculosis claims nearly 100 lives every day.
This patient has a mass on the neck. I am thinking that this is an extrapulmonary tuberculosis.
The disease is particularly deadly in remote parts of the island nation.
Some communities haven't seen a doctor yet.
Early detection is crucial to save lives. Filipino doctors are experimenting with drones to speed up testing and treatment.
We'll send the samples via drone, and then they will test and we'll get the results within 1 hour.
But they still face practical challenges.
Drone technology that can fly better in strong wind conditions and in extreme weather conditions, those are the things that I'm still looking for.
101 East meets the pioneering doctors using modern technology to fight tuberculosis in the Philippines.
Maupay nga aga, masapang katanan. Kailangan mag-ready na para sa medical mission.
A team of doctors are on their way to the remote village of Eparayan de Turag in the eastern Philippines. It's a 3-hour boat ride followed by a 4-hour trek on foot. Leading the way is paediatrician Dr. Heidi Sampang.
Okay, where are we going?
Are we here yet?
We're halfway.
This region has been marred by decades of conflict. Today, more than 50 soldiers accompany the doctors for their safety. The team includes 10 volunteer doctors and support staff. They are the first medical team to come to this village.
There are 600 people living in there, and then for the clinic there will be 3 more barangays joining, so there will be 4 barangays joining. So probably around 2,000 patients target population. So the reason why we're going there, because they don't have access, so we go there because no one wants to go here. Very wet. Surgery po yan. Surgery is may mga nakasulat. Opo.
Nakapirma ka pa?
For the next 2 days, this school will become a field clinic.
Hindi ko makuha kung 16.
Ilan taon ka na, Jane? 8? So, kailan po nag-umpisa to, Tay?
Tamas kasimaran siya.
Nagsimula siyang parang butlig. Saan nag-umpisa? Sa kamay?
Sa kamay, tapos lumaki.
Dito rin. One week lang yan.
Hindi ko ma-sure kasi.
Kasi mukhang may infection siya na sobrang lala, ang tinatawag impetigo. So ang gagawin, syempre, dapat nag-umpisa yan sa yung hygiene ba? So dapat bigyan natin ng sabon, malinis yung tubig na panligo. Kung medyo madumi yung tubig, pakuluan para di masyadong para mamatay yung mikrobyo ba? Yung antibiotic for 7 to 10 days, so tuloy-tuloy yun, bibigyan kita ng gamot. Huwag mong itigil po, dapat tuloy-tuloy.
The village is in northern Samar province, where 1 in 5 families live in poverty. Due to limited infrastructure, clean water and electricity remain inaccessible to many communities here.
Some communities haven't seen a doctor yet. That's what our purpose is, to bring the highly specialized medical care in remote areas.
A major threat is tuberculosis, or TB, the world's deadliest infectious disease. Without treatment, half of all cases are fatal. The Philippines has one of the highest rates of TB infection in the world, with 6 out of every 1,000 individuals affected. Risk factors include weakened immune systems due to poverty, malnutrition and limited access to healthcare. Dr. Eileen Carlos is examining a patient with a persistent cough.
Medyo meron tayong naririnig sa plema ni tatay, ha? Okay. Tapos, yung ubo, nabalik-balik po ang ubo. Tama po?
Pabalik-balik.
Pabalik-balik. Pero may dugo. Tama po. Okay. Tay, medyo nakarinig ako ng plema sa likod mo, no? Pero kailangan pa-testing natin yung plema. Meron yung mga taga-DOH dyan.
Samples have to be sent to the nearest lab 7 hours away. The team must confirm whether it's TB. If so, it's bad news for the entire village, as the bacterial disease is highly contagious.
It's very sad. What's sad is because there's treatment, but we're still increasing just because we're not able to identify these cases. Sa propeller natin.
The key to fighting TB is early detection, because identified patients can start treatment and be isolated immediately to help reduce transmission of the disease. In 2022, Dr. Sampang began using cargo drones to fly out samples and speed up testing.
Taking off.
Today is her first experiment with drone delivery in a mountainous region. The rugged terrain and shifting weather conditions demand drones with specific capabilities and an experienced pilot.
Check map to confirm.
It's estimated the round-trip flight will take 14 minutes.
Medicines, antibiotics, vaccines can be delivered because it can travel really fast. We can also send TB testing because sometimes that's the issue here. You get the samples here, test all the patients, send the samples there so they don't have to travel. Well, definitely it flew. It was able to do its function, but then I was not happy because it's not so easy to operate. Even with an experienced pilot, we encountered some issues right now. For example, the wind was so strong out there, so at least we tested the technology. It's still not the best in terms of operability.
The lab will return the sputum sample results within a day, much faster than the traditional route. But Dr. Sampang wants to explore other drone models that are easier to operate. Dr. Sampang runs a non-profit organisation called Philippines Flying Labs that focuses on health and environmental issues in remote communities. Its medical missions are mostly funded through donations. A new cargo drone model has just arrived from Spain.
This is fully autonomous. It can fly on its own as long as you have an accurate GPS system. It's much smaller, it's compact.
Dr. Sampang's goal now is to deliver medical supplies without human intervention or a pilot over a 7-kilometre range.
Linking drone. So ito yung location niya ngayon. Locations. 656, 564.
3, 2, 1.
Hinangin.
Hindi kaya.
Off natin. Off natin.
Oo. Ayun, no, layo. Hindi siya makapwesto
Oo.
Kita niya.
Malakas yun.
Baka ganun nga yung kaya pumunta ro.
Okay. Finding the correct drone technology that can fly better in strong wind conditions and in extreme weather conditions, those are the things that I'm still looking for. Then of course, we want drones that are affordable but very resilient and easy to operate. Okay naman yung LEC. Okay.
Tapos dito po yung SD card.
Dr. Sampang's next medical mission carries some risk.
Two Philippine Army are killed by armed men in Basilan province. 2 other people died in the attack.
Hearing about this news actually brought a little bit more of anxiety for us because we are ready to deploy. So safety is a concern at this time.
Basilan is a small island province in the southern Philippines. Since the 1990s, it has been the scene of numerous attacks by armed groups.
We checked with our local partners, with the military and the army, that we're still good to go. They said nothing untoward happened since the last incident.
The 11-strong medical team take an early morning flight from the capital Manila to Zamboanga City. To ensure their safety, armed military troops escort the medics, first taking them across the Basilan Strait by boat. It's then another 2 hours on the road, travelling in convoy through military checkpoints before they reach the village of Nkaya-Pukan. At least 100 patients have gathered here in anticipation. The military escort chose this village to set up the mobile clinic. It's centrally located and near a main road for quick evacuation in case of an attack. Orthopaedic surgeon Dr. Inat Avangalista is performing a procedure.
matuluan ng dugo yung mata mo. Kaya sinasabi ko, pikit ka lang, ha? Huwag ka didilat, ha? The mass is a sebaceous cyst. If there's a blockage in your sebaceous glands, it can form a mass or a cyst. The people, they're also thinking that maybe it's a bad mass or cancerous, that it is dangerous. I look at the mass and then I tell them and assure them that it is not bad tumor, it's not malignant. The happiness or the fulfillment of being able to help people in these remote areas is better or is best than what I earn in my clinic or in private practice. Saan dito, Max? This patient has a mass on the neck. Gano'ng katagal na? For 3 months now. This looks like a lymph node. It is multiple. See, it's very big. It's on top of the sternocleidomastoid muscle, and it is common for extrapulmonary TB. I am thinking that this is an extrapulmonary tuberculosis.
Extrapulmonary TB is what we call it. It shows up at lymph nodes, it shows up at the gut, at the stomach, on the intestine. TB cases are still rising here in the Philippines compared to the rest of the world.
In 2023, the country logged more than 575,000 cases of new or relapsed TB, the highest in its history.
Finding the cases is the most important thing.
So I think this is also another case. Si Mami, 2 years, tita na raw yan, tita.
TB makes no distinction between young and old. In 2023, the Philippines recorded about 50,000 TB cases in children below 15 years of age.
So now the next step will be testing, right? And then we'll send the samples via drone to the RHU, and then they will test and we'll get the results within 1 hour.
Laboratory for sputum exam for gene expert to confirm the diagnosis of extrapulmonary TB.
(495-345) space 122.111.281. May radyo naman kayo doon, dito, Doc, no? Para sabihin nilang, drone is on this way, ganyan. Okay?
Okay.
(6.500.286/122.120.576).
For Dr. Sampang, this flight is more than just a test. It's the culmination of years of research and setbacks. Now comes the moment of truth. Can the drone make it back in one piece after delivering the samples.
Good, good, good. Kala ko aakyat ako ng truck. Woo! Yes.
Success.
Success, nag-land. So I think as long as we test it first and make sure that it's accurate, then we can definitely give it to the community. But in terms of operability, it's easy for them to understand, it's easy for them to use. You just have to make sure that the GPS coordinates are accurate.
In the long term, Dr. Sampang's plan is to provide remote communities with simplified drones so that they can send their samples to test centres on their own. A potential game changer for TB detection and treatment, and a first in the country.
This patient is positive for TB, so then we can start the process. Mahaba po yung na duration, no?
With proof of the boy's TB diagnosis, he will now undergo treatment funded by the government.
For tuberculosis meds to be effective, you have to take it every day consistently for 6 months. Otherwise, if they miss, a 1-week dose, you'll develop an extremely drug-resistant organism to tuberculosis.
Positive kasi yung testing dun sa plema, malamang ibig sabihin mayroon po kayong TB. Siyempre, kung may TB man kayo, may libreng gamot naman po tayong pinoprovide.
Unfortunately, these TB medicines have side effects also. That's why probably some people stop taking them. So you have to educate them.
And the mass will disappear because if it's really TB. Okay, so observe, mag-inom ng gamot. Pag hindi mo siya mawala, magbalik ka lang kay Dr. Stanul. Ha? Pwede, liliit kasi siya pero medyo matagal. Kasi matagal na treatment yun siya. Ha? Okay?
To ensure that patients follow their medication plan, Dr. Sampang will be relying on the military personnel stationed in Basilan.
Tapos yung ito for the patients is yung tablet. Ito, mamamonitor. So at least, hindi lang telephone, magiging siya, live. Oo. Dito, siguro, for TB compliance, pwede nating sabihin sa kanila na yung may isang doctor na magpa-follow up talaga sa kanila to monitor yung weight and to make sure na yung mga side effects. I can discuss.
Maganda yan, ma'am, actually, kasi karamihan sa barangay, yung iba nahihirapan magpunta sa poblasyon para magpa-check up. Yung iba walang pera.
Yun nga.
So malaking tulong ito, ma'am, sa kanila. Sige, ma'am. Rest assured, ma'am, na ingatan namin ito. No?
Dr. Sampang is determined to ensure that people living in remote communities are not left behind and that technology benefits everyone.
I believe we're all interconnected regardless of race, religion. We're all composed of the same atoms and molecules. Our purpose is to ensure and to make the people aware that healthcare is a human right. That's my calling in life, yeah.